Hello, I am Amritaksha Deb. I am a nephrologist and practice in Kolkata. Today we'll be talking about peritoneal dialysis. So firstly, this is not a very common modality. So that is the reason when we say dialysis, people think of hemodialysis, that is the blood dialysis that we frequently see, and do not think of peritoneal dialysis. We have to realize that peritoneal dialysis is another modality that is available for management of end-stage renal disease CKD5D, and this is a modality which has equal survival. So people will live equally on hemodialysis and this modality, which is a little bit neglected. So we'll firstly see what this process is and what are the pros and cons of peritoneal dialysis. So basically this process is a very simple one. It does not require any kind of machine, any machinery. So what is done is basically a catheter or a pipe is placed inside the peritoneal cavity, that is inside the abdomen. And once we place it inside the abdomen, we instill clean fluid with certain electrolytes in it. And the peritoneal membrane has a blood supply, which basically drives the process. So what happens is the excretory products that we are supposed to remove from the blood, they seep out from the blood to this fluid, and we remove the fluid with all these extra products from the body, and we instill fresh fluid. So this is the basic simple process in which peritoneal dialysis is done. The advantages of peritoneal dialysis are that firstly, you do not need to go to a hospital. Hemodialysis usually requires you to go to a hospital at least twice or thrice a week. Peritoneal dialysis can be done at home. It does not require any special process or any special machines. Secondly, is the fact that it helps in preserving our residual renal function. So what exactly is residual renal function? We usually begin dialysis of patients when they have certain percentage of kidney function still left. Let's say 7% of kidney function is left or 8% is left, and we begin dialysis in these patients. Once we begin dialysis, what happens is with hemodialysis, patients have frequent hypertension, patients have large amount of fluid which is removed from the body. All this results in rapid loss of whatever residual renal function is there. This is indicated by rapid decline in the urine output. So once patients start on dialysis, hemodialysis, they lose their urine output within the next couple of years. In case of peritoneal dialysis, we are able to better preserve this process. It's a softer process, it's a slower process, so it's more hemodynamically stable. Those who have heart diseases do well with peritoneal dialysis. In certain patients, we would never have been able to do hemodialysis because of instability hemodynamically, but they can be dialyzed peritoneally. Other issue is that the peritoneal dialysis also provides us a number of calories because the fluid used is basically dextrose that we use, which gives us calories. So certain calories are there, and as the dialysis is ongoing, they usually do not require any kind of restriction, so they are able to take liberally food. But there are certain cons as well. The first con would be the chance of infection. As we have a pipe which we have instilled into the abdomen, there is higher risk of having infection into the abdominal cavity. This is called peritonitis. The peritonitis rate should be 1 in 4 years, however, so it's not that frequent as we assume it to be. The second issue with peritoneal dialysis is that it's not a very exact kind of science. In hemodialysis, we are able to exactly feed whatever amount of fluid we need to remove from the body. We are able to feed the electrolytes that we want to set. This is not possible in case of peritoneal dialysis. We have different amounts of fluids, but everyone's peritoneal membrane behaves differently. Then we have problems of catheter malposition. The catheters can get displaced or the catheters can get blocked. This results in failure of the process. However, considering all pros and cons, as it is a modality which has equal survival to hemodialysis, it is advisable that we also think of this in our armamentarium of management of chronic kidney disease stage 5D that we call, or dialysis dependent patients. Thank you.